Across the country, there are an estimated 621,000 Canadians involved in organized hockey leagues. In this arena in St. John's, Newfoundland last Sunday is one of the few leagues still operating in recent weeks. That's because it turns out that in the COVID era, indoor hockey is one of the more dangerous activities you could take part in. There have been dozens of COVID outbreaks in arenas around North America. Hockey can be played in Newfoundland because the province is down to a handful of active cases.
Hockey's pretty big here, and just being a part of that and the whole hockey culture, you know, it's a huge part of who I am.
Duan Street was a longtime figure skater who converted to hockey 5 years ago and is now devoted to the game, even in the time of COVID.
Latest update, we're down to 5 active cases, and you know, I mean, we see 3,000, 2,000 cases a day in other places, and that just kind of drives home how fortunate we are to actually be able to come out to the rink on Sunday night and play a game of hockey.
One of the early warnings about the COVID danger of indoor hockey came with an amateur game in Tampa Bay, Florida last June. The game became the subject of a morbidity and mortality weekly report by the Atlanta Centers for Disease Control because one asymptomatic infected player passed on the disease to 13 of the 22 other players on the ice with him, including 5 who showed no symptoms, and to 1 rink attendant. The June Tampa Bay outbreak was not an isolated incident. In the following months, hockey's superspreader events infected 23 players in Georgia, 17 in North Carolina, 13 in New Jersey, 17 in Connecticut, 108 in Massachusetts, and 158 in New Hampshire. 7 northeastern states banned hockey for November and December. In Ottawa, a single hockey practice in December led to 89 infections. In Saskatchewan, there were 20 outbreaks linked to arenas. And there was a famous case where a BC team traveled to Alberta and brought the infection back to their families and co-workers.
I can tell you that it was several dozen families that were affected, several businesses that were affected, long-term care that was affected.
Way back in March,
the widespread hockey COVID outbreaks are no surprise to Jeffrey Siegel, a professor of civil engineering at the University of Toronto and an expert on air quality and ventilation.
The big problem with arenas is that there's a bunch of additional risk factors. So number one is that, you know, people are working hard, both inhaling and exhaling, producing more respiratory droplets, being exposed to more respiratory droplets. Number two is you're playing on ice. Ice, because it's cold, is going to lead to the air near it being more dense and less likely to rise up. So what you end up with is a layer of pollutants being trapped near the ice surface. And that layer of pollutants, you know, includes the things being breathed out by people on the ice, like those respiratory droplets.
There have been numerous studies of ventilation and airflow in hockey arenas in the last 20 years, and that is mostly because of the Zamboni machines that clean and resurface the ice between games and between periods. Older Zambonis like this have internal combustion engines that emit exhaust, polluting the arena air breathed in by players and fans. The studies found that the polluted air tended to remain quite close to the ice surface, even when there was ventilation designed to blow contaminated air out of the building. The air near the ice is trapped by the plexiglass barriers above the hockey boards.
This is an air quality monitor.
Air quality monitors measuring parts per million of carbon dioxide and other pollutants are used to check ventilation at ice level.
We can apply some of that to what we're now worried about with COVID. And that's where we have a potentially infected player on the ice, and the pollutants, you know, potentially get trapped near the ice surface, and even more respiratory aerosols being produced because people are working hard because they're doing this physical activity. And then you combine that with, you know, these higher concentrations near the surfaces, people breathing deeply because they're working hard too, and you can end up potentially with some quite high exposures.
When it comes to COVID transmission in hockey, there are additional risk factors beyond the game being played on the ice. Between shifts, the players are catching their breath on the benches, often coughing and spitting. And there is also close proximity in dressing rooms.
The hockey we're playing is not body contact, but you're still going in the corners, you are still in contact. So we do think about stuff like that, and of course when you're on the bench, definitely. One of the rules at one of my skates is nobody's allowed to spit, and hockey players, we're all guilty of it. So just stuff like that, it's a little bit, some stuff you just have to keep in the back of your mind.
In Barrie, Ontario, Hugh Campbell has been a minor hockey league director for 40 years. In November, he had to deal with a COVID outbreak in a team of 15 and 16-year-old players after one player became ill the day after a practice.
So we immediately isolated the whole team for a 14-day period. During that 14-day period, 8 of the boys actually ended up testing positive. So it was, in hindsight, a good thing that we got on it right away, got them all in isolation, and managed to curtail it just to the one team and one group.
Oh, Canada.
Given the dangers of contracting COVID while playing hockey, you might wonder why there have not been more outbreaks connected to the National Hockey League. First off, there are the arenas themselves.
NHL arenas are a very different beast than a recreational arena. The amount of money that goes into them is very different, obviously. So I'm sure they have better ventilation. I'm sure they have a lot more protection for the players.
Away we go, Sidney Crosby and Sean Couturier.
The NHL also had strict bubble regulations to protect players, designed in part by infectious disease expert Dr. Isaac Bogosh.
What you saw at the end of the day were, I think, very tight protocols that took a lot of buy-in and were adhered to by everyone, not just the players, but all the other personnel in the bubble. And coupling that with a bubble approach and rigorous testing, plus adherence to these tight protocols, and that made for a very successful remainder of the NHL season and playoffs. And they did so without having any positive cases.
We do understand the risk, and we're fortunate that our team is a close circle of friends. So that's pretty much been our 20-person bubble now since everything has opened up.
So I'm sure people are thinking, okay, so what do we do? How do we get back to playing hockey? People love to play hockey.
I think it's going to come down a lot to the individual and the choices. So if someone lives in a household with a vulnerable family member, maybe someone who's older or someone who's got, a respiratory condition that makes them more sensitive to COVID, that might be a good time to say, yeah, maybe I shouldn't play hockey this season.
One solution to preserve community hockey this year would be moving as many games as possible to outdoor ice.
I think you can get out on the outdoor ice and have a safe experience as long as it's done well. So rather than saying no, 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 I think we should say, well, is there a way that we can get around this and do this safely? And if careful and if done right, I think you probably can do it on the outdoor ice in a much safer environment.
Of course, the lower the rate of community infection, the less chance of encountering an infected hockey player on the ice. Minor hockey is still being played in Newfoundland, Labrador, and PEI, but for the moment is pretty much banned in the rest of the country. Terence McKenna, CBC News, Toronto.